Nigeria preparation for the second phase of COVID-19 vaccination, involving more resources and logistics, is highly commendable. And yet again, this is an occasion to recognize and to applaud Nigeria. Without proper preparation, we wouldn't be able to receive this Johnson & Johnson vaccine today. Moreover, a multi-sectoral approach at different levels of the government has been set up to address issues around COVID-19 vaccine hesitancies, if any. As I always mention at different fora, vaccines are a critical tool in the battle against COVID-19. These vaccines are safe and effective and will be the game changer. But for the foreseeable future, we must continue wearing masks, physically distance, and avoid crowd. The Johnson & Johnson Janssen vaccine we have today was listed for emergency use by WHO on the 12th of March. The vaccine has been authorized for use in many countries, including in Europe, in the United States, and others. As the only single-dose vaccine approved for emergency use to date, the vaccine may be an important tool for accessing hard-to-reach populations, thus playing a key role in preventing infection and reducing deaths across Nigeria. Let me seize this opportunity to say that this pandemic still has a long way to run. Nigeria is already experiencing a third wave, and we need to work together to ensure that all preventive measures put in place are maximized to reduce the impact of COVID-19 on our lives. And vaccination is one of these tools that we need to scale up to ensure that the entire population is protected until such time that we reach herd immunity.
Let me emphasize that the Nigerian government is committed to safe, equitable, and effective COVID-19 vaccination of all eligible persons in the country. The availability of different vaccine brands does not in any way mean that some categories of people are being selected for high-quality vaccines while others are targeted for low-quality vaccines. All COVID-19 vaccines approved by the World Health Organization and NAFDAC are safe and can deliver adequate protection against COVID-19 vaccine, against COVID-19. You are aware from all of the data that is coming from different countries that COVID-19 vaccines protect against severe forms of the disease, hospitalization, and deaths. The different vaccines have exactly the same ability to protect against the disease. The different proportions or percentages in terms of efficacy depends on the type of clinical trials and the populations that have been assessed. However, these vaccines have been proven to protect against COVID-19. So please take the opportunity of going to the designated healthcare centers to get your vaccines. We will continue to count on you, the media, for dissemination of true and accurate information to keep Nigerians informed and educated about COVID-19 vaccination. We also hope that those who are misinforming people will begin to understand the need for Nigeria and the rest of the world to overcome the COVID-19 pandemic and recover from the adversities it has imposed on our economies and social lives.
Of NPHCDA chair and the Nigerian government for your forethought and preparedness to procure 29.8 million doses of Johnson & Johnson through the AVAT facility. Without that anticipation and forethought and good planning, we wouldn't see this, these doses, 177 Johnson & Johnson doses, come in today. And as my colleague has said, that they will come in on a regular basis over the next few months. But finally, and importantly through you, the media, is to say to all people in Nigeria, last week we received the Moderna vaccines, today the Johnson & Johnson vaccines, next week we will receive more AstraZeneca vaccines. They are coming in on a regular basis. This is the time to step up and get vaccinated. to take your responsibility, whether you're an individual, whether you're a religious leader, a traditional leader, or a governor, is to encourage all your people to take the vaccines as quickly and as timely as is possible in an orderly fashion. The vaccines are coming in and we must do our part.